a multi-donor, multi-country, and multi-organizations program supported by Afreximbank, BADIA, ISDB, ITFC, ISEC, ICD, and the OPEC Fund for International Development. The Arab-Africa Trade Bridges Program, AATB, aims to promote and increase trade and investment flows between African and Arab OIC member countries. In this podcast series, we will be hosting key stakeholders to discuss intra-Africa trade, cross-border trade between the Africa and Arab regions, health, and economic recovery. On this first episode, we welcome Mr. Reuben Gisore, Technical Director at the African Organization for Standardization, ARSO, to discuss the implementation of AATB's Harmonization of Pharmaceutical Initiative. Reuben, how did the implementation of Phase 1 help mitigate the impact of the COVID-19 pandemic?
Yeah, the first phase that we did with the harmonization of these standards, it was a rapid phase or a fast tracking phase that involved developing standards which were required for materials and processes to immediately address the issues that we were facing. You recall that during that time, supply chains were disrupted, and therefore we needed Africa to be able to manufacture materials that were needed immediately to address the pandemic. This included things like personal protective equipment, gloves, isolation gowns, ventilators or respiratory equipment, face masks, sanitizers, disinfectants, detergents, and we also had guidelines for the hospitals to be ready to handle the surge or the increases in emergencies occasioned by the pandemic. So the committees that were established developed the guidelines to establish field hospitals, for example, which would accommodate large numbers of patients instead of depending on established facilities that were being overrun by the number of patients received. So a number of countries adopted these standards for their industries to start manufacturing the materials that were required. For example, the issues at that time were the masks, the face coverings, the detergents, sanitizers, and disinfectants, which were needed to contain the infections in hospitals or in any other healthcare facilities. So these are the standards we did, and we had a very good response from the experts across the continent who came together and provided the information that was needed. And countries were always constantly calling upon us to provide those standards that could put them at a footing that were able to make sure that their supplies did not run out. If you recall, at that time, really the issues were about preventing the infections as well as handling the surge in the increases in patients that were received in hospitals.
Sure.
Yes.
So based on that, what are the expected outcomes of Phase 2 and how is ARSO mobilizing efforts to achieve this?
Now, Phase 2 is a more long-term outlook that we have to ensure that the healthcare facilities are improved to the point where they can now handle the routine healthcare services as well as handling emergencies if they were to happen again. So the pandemic gave us lessons that we really needed hospitals to be ready to have equipment, to have facilities, to have systems which can handle emergencies, which can also handle shortfalls that we had witnessed, such as lack of oxygen in the hospitals. And therefore, these phases are really geared towards ensuring that the hospitals are well equipped, they are well staffed, they have the competencies, and they have the equipment which will be required in case of any other outbreak, as well as ensuring that they can offer quality healthcare services at the moment that the citizens require. So a lot of the standards that we'll be doing, you will see that they include the construction of hospitals, especially specialist units for emergencies, for routine work, and also staffing levels that can make a hospital determine and say that we are either level 5, we are level 6, or we are level 4 And this is what we can handle at the moment. So
Yeah.
this time around, we have also included health informatics as part of that, which can serve so that these references or in the patients have records which can indicate their treatment history, and therefore it is possible for a follow-up to be done to ensure that we do not misdiagnose our patients and get the wrong treatment. So it's an overall improvement. That is, the outlook is the overall improvement of the healthcare services as well as the facilities to ensure that the quality of service they offer meets expected standards at the international arena.
With that in perspective, so obviously phase 3 is still very much long term, but what do you expect the outcomes of phase 3, or how is phase 3 is going to be rolled out, and what are the expected outcomes of phase 3?
Now, phase 3 is more of the implementation phase to ensure that the countries have understood the benefits of the standards. The regulators within the countries have understood how important the standards are, because as we develop these standards, we are also developing guidelines that will assist regulators to address issues of procurement, for example, to address issues of the services or the professional healthcare services, so that they use standards instead of depending on a rule of the thumb to regulate the sector. So it is to ensure that the countries adopt the standards. They oriented their manufacturing capabilities towards manufacturing some of the materials and equipment that we have foreseen. For example, ICU beds, emergency rooms, and equipment which are required in those. So the idea now is to really ensure that the quality culture is embedded in the countries to offer very competent healthcare services to the citizens. So it's an implementation phase. Is one of the most difficult areas, because traditionally people have believed that they know what is best. I mean, it's a profession where people tell you we are professionals. We don't need anybody to tell us about standards. We know our standards. But you find that indeed they require to understand how the standards help to improve the professionalism, help to improve the facilities, help to improve the way they handle patients, and ensure that the satisfactory healthcare service that is offered in the country. So that implementation phase is what we are foreseeing to be very critical, and we are partnering. Of course, at the moment we have started partnering with the regulators in the countries to ensure that they start pushing forward the idea of adopting the standards and using them in their work.